My name is Ryan Hartman. I'm a student physical therapist with the University of Cincinnati, and I'm coming to you today from Guenthner Physical Therapy. This will be one of a few modules that we'll have online, but the first one we're going to talk about is type 1 diabetes. First, I'm going to talk about the normal bodily processes and what happens when you don't have diabetes, and then I'm going to talk about what's happening within your body for those who have diabetes. So I'll be using this whiteboard here just to kind of demonstrate, give a little animation to what I'm talking about to make it a little more exciting, a little more easy to follow. So first I'm just going to describe what's happening within your body in those that do not have type 1 or really type 2 or gestational diabetes for that matter. What happens when you have a meal and it's digested, the carbohydrates and the proteins and the fats get broken down and essentially end up in their key components in the blood. And type 2, well, type 1 and 2 diabetes are dependent really on insulin. So type 1 diabetes is what's known as insulin-dependent diabetes, and I'll get a little bit into the role of insulin and how it affects the nutrients that we eat. So when we eat, we're going to say this is the bloodstream, and I'm going to put these little G's inside. This stands for glucose. When carbohydrate is broken down in the stomach and in the small intestine, it is absorbed into the blood in a form known as glucose, more commonly known as sugar, so we end up with blood sugar. After we have a meal, we get a spike in blood sugar. What happens as our body's response to that is our organ, the pancreas, which has all these little cells, these little dots I'm drawing, are going to represent what are called beta cells. Beta cells are responsible for producing insulin, which I just referenced. Insulin is the key component in diabetes. So the pancreas, the beta cells in the pancreas are going to produce insulin, and the action of insulin is to get this glucose out of the blood and into the bodily cells. So some of the cells that the glucose is deposited into, we have our muscle, fat, and also liver cells. Glucose, once it's absorbed into these cells, will be stored as glycogen, which is just a form that our cells can use in the future as energy. So the insulin in a normal person and those that do not have diabetes, when things are functioning as they should, it's the insulin's job to come over and grab the glucose and transport it down here into the cells of our body to be stored as glycogen. And it's the responsibility of the pancreas, once we have this rise in blood sugar after we eat, to produce the insulin. Because of these beta cells, they produce the insulin that allows the glucose to be transported into the cells. What happens normally is there are these little receptors on our cells. We'll say these little receptors. What happens is the insulin that's produced by the pancreas is going to come down and it's going to bind. So we have insulin binding on all these receptors. What happens after that is they're little transporters, little glucose transporters that are in all of our cells, and they stay dormant throughout the majority of the time except when the insulin binds. So once the insulin binds with the receptors, these glucose transporters, these little tunnels here that I'm drawing on the cell, they come to the surface of the cell. And what they do basically is they provide a tunnel for the glucose to transport into the cell. So we have this glucose coming down through these little tunnels. All this glucose in the blood is making its way down into the cells, and that's how we get the glucose into the cells to be stored ultimately as glycogen. That's what happens normally. Now I'm going to erase all this, and I'm going to talk about what happens in type 1 diabetes. Type 1 and type 2 diabetes, as I said, are different because type 1 diabetes is insulin dependent, and it's what is known as an autoimmune disorder. An autoimmune disorder is basically when your body's defense system accidentally ends up attacking its normal cells, which is what happens in type 1 diabetes. So in type 1 diabetes, we've still got our bloodstream that's full of glucose after our meal. But what has happened in type 1 diabetes is all these little beta cells that I referenced earlier, which are responsible for producing the insulin to get the glucose out of the blood, with this being, I'll go ahead and write it up here for you, with it being an autoimmune disorder, what happens is these beta cells of the pancreas are killed. The body accidentally wipes all these cells out, and this is what's known as a rapid onset type of a disorder. This generally happens in a week to, say, about a couple weeks or a month. And some of the symptoms that come along with this is people will notice that their increase in thirst, their appetite is spiked, they may be dehydrated, and what can show up when they go to see their doctor because of these symptoms that they actually have increased glucose in the urine. They're basically expelling all this glucose. So without these beta cells, the cells of the body become starved of glucose. So all this glucose in the blood is basically now trapped. The little pathways that were provided by the insulin to get the glucose into the cells is no longer there. So we have an increase in the blood glucose, which manifests itself in the symptoms that I just described, and it's those symptoms that eventually lead these people into the doctor. And how this type of diabetes is managed is what's known as insulin replacement therapy. For those of you out there that have diabetes, type 2 diabetes, you may know this already, but type 1 diabetes is basically treated by insulin replacement therapy. You take shots of insulin throughout the day along with your blood glucose monitoring to put insulin into your bloodstream to help get the glucose out. Type 1 diabetes is only prevalent in about 5 to 10% of cases. Out of all of diabetes, type 2 makes up the majority, but this type 1 diabetes is a more rare form, but it can be managed, and we'll talk about in another module how exercise plays a role in that also.